Imagine this: a sudden illness strikes, a life hangs in the balance. The uncertainty is overwhelming, but instead of focusing on recovery, families face crippling medical bills. The stress of financial strain adds to their emotional burden. This is the harsh reality for millions without health insurance. They are left vulnerable, with limited options. They face impossible choices, deplete their savings, mortgage their future, or even forego life-saving treatment. The decisions are heart-wrenching. The consequences can be devastating, pushing families into poverty and despair. The ripple effects are felt for generations. The consequences can be devastating, pushing families into poverty and despair. The loss of a home, the strain on relationships, the impact on children's futures. This is the human cost of a system struggling to provide affordable health care. The struggle is real and ongoing, but this struggle is not new. It has deep historical roots. Throughout history, people have grappled with the financial burden of illness. The challenge has always been there. From ancient societies to modern nations, the quest for a solution has been a constant. The journey is long and complex. This is the story of that journey, a journey to understand the evolution of health insurance, its origins, its triumphs, its failures, and the lessons learned along the way. The development of health insurance has been marked by significant milestones and setbacks, and its future. The future holds promise, but also uncertainty. It's a story of innovation and struggle, of social responsibility and individual choice. The balance between these elements is delicate. It's a story that continues to unfold today, impacting the lives of every American. The decisions we make now will shape the future of healthcare for generations to come. It's a story that continues to unfold today, impacting the lives of every American. The quest for affordable healthcare is a shared journey, one that requires collective effort and understanding. The concept of health insurance, of pooling resources to mitigate risk, has ancient origins. It is a practice that has been woven into the fabric of human society for millennia, reflecting our innate desire to protect one another. In ancient Greece, societies formed guilds that not only provided professional support, but also offered a rudimentary form of health coverage for members. These guilds were more than just professional associations. They were communities bound by mutual aid and shared responsibility. These guilds would collect regular dues from their members, creating a communal fund. In return, members received financial assistance during times of illness or injury, ensuring that no one faced hardship alone. This system of shared risk was a precursor to modern health insurance. Similarly, in ancient Rome, benevolent societies emerged, offering burial assistance and some medical care to their members. These societies were often organized around religious or social groups, further strengthening the bonds of community. These early forms of mutual aid demonstrate an inherent human desire to share risk and support one another in times of need. They highlight the importance of community and collective action in providing security and care. They represent the very foundation upon which modern health insurance systems are built. The principles of shared risk and mutual support have endured through the ages, evolving into the complex systems we have today. While rudimentary, these ancient systems highlight the enduring human need for protection against the financial devastation of illness. They show that the quest for health security is as old as civilization itself. They are a testament to the power of collective action, and a reminder that the quest for affordable healthcare is not a modern invention, but rather a timeless human endeavor. The seeds of shared risk planted in ancient times continue to grow, shaping our approach to health and well-being today. Fast forward to 19th century Europe, where a revolutionary idea took root. Otto von Bismarck, the Iron Chancellor of Germany, faced growing social unrest and the rise of the labor movement. His solution, a groundbreaking system of social insurance. In 1883, Germany enacted the Sickness Insurance Act, a landmark piece of legislation that created the world's first compulsory health insurance program. This program, funded by contributions from both workers and employers, provided coverage for medical expenses and lost wages due to illness. Bismarck's model, driven by a desire for social stability and economic productivity, would become the blueprint for social health insurance programs around the world. It marked a fundamental shift in thinking, recognizing healthcare not just as an individual responsibility, but as a societal one. Across the Atlantic, the United States was grappling with its own healthcare challenges, which were becoming increasingly complex as the nation grew. The late 19th and early 20th centuries saw the rise of industrialization with its inherent risks of workplace accidents. Factories were bustling with activity, but they were also fraught with dangers, from machinery malfunctions to hazardous working conditions. To address this, private companies began offering accident insurance, initially covering only specific injuries. These policies were a significant step forward, providing workers with some financial protection against the perils of their jobs. As medical care advanced and hospitals became more central to healthcare delivery, a new model emerged: hospital insurance. This model aimed to cover the costs of hospital stays, which were becoming more common as medical technology and practices improved. In 1929, Baylor Hospital in Texas launched a prepaid plan for teachers, guaranteeing a certain number of hospital days for a fixed monthly fee. This plan was revolutionary, offering a sense of security and predictability in an era when medical expenses could be financially devastating. This innovative plan, the precursor to Blue Cross, marked the beginning of modern health insurance in America. It demonstrated that prepaid health plans could be both practical and beneficial, laying the groundwork for future developments in the field. The success of Baylor's plan sparked a wave of similar initiatives, leading to the formation of various Blue Cross plans across the country. These plans were designed to make healthcare more accessible and affordable for a broader segment of the population. These plans, initially focused on hospital coverage, would later expand to include other medical services, paving the way for the comprehensive health insurance plans we know today. Over time, they evolved to cover a wide range of healthcare needs, reflecting the growing complexity and scope of medical care in the modern world. Section 5. Wartime shift: employer-sponsored insurance takes hold. World War II brought about profound changes to the American workforce. With wartime wage freezes in effect, employers sought alternative ways to attract and retain employees. Health insurance emerged as a valuable benefit, and employer-sponsored insurance rapidly gained popularity. This trend was further solidified by a series of IRS rulings in the 1950s. These rulings determined that employer contributions to employee health insurance premiums were tax-deductible, making it even more financially advantageous for businesses to offer health benefits. This wartime shift had lasting consequences, establishing employer-sponsored insurance as the dominant model in the United States. It also created a system where access to healthcare became increasingly tied to employment status, a dynamic that continues to shape the healthcare landscape today. Section 6. The Great Society Medicare and Medicaid transform healthcare. The 1960s witnessed a wave of social change in America, and healthcare was no exception. President Lyndon B. Johnson's Great Society initiatives sought to address poverty and inequality, including the lack of access to healthcare for millions of Americans. In 1965, after years of debate, Medicare and Medicaid were signed into law. Medicare, a federal program, provided health insurance to Americans aged 65 and older, regardless of income or health status. Medicaid, a joint federal-state program, offered coverage to low-income individuals and families. These landmark programs dramatically expanded access to healthcare for millions of previously uninsured Americans, particularly seniors and the poor. Medicare and Medicaid remain cornerstones of the American healthcare system today, providing a vital safety net for vulnerable populations. Section 7. Managed care emerges: HMOs and the rise of private insurance. The 1970s and 1980s saw the significant rise of managed care, driven by concerns over rising healthcare costs. Health maintenance organizations, or HMOs, emerged as a cost containment measure, offering comprehensive care for a fixed monthly fee, but with restrictions on provider choice. Private insurance companies expanded their role, offering a variety of plans with different levels of coverage and cost-sharing options. The healthcare landscape was becoming increasingly complex, with a growing array of options for consumers to navigate and understand. While managed care aimed to control costs, it also sparked debate about the potential trade-offs between cost containment and patient choice. This tension between affordability and access remains a central challenge in the American healthcare system today. Section 8. A system in crisis: soaring costs and the uninsured. Despite significant advancements in medical technology and the expansion of insurance coverage, the American healthcare system entered the 21st century facing significant challenges and obstacles. Healthcare costs were spiraling out of control, placing a tremendous strain on individuals, families, and the overall economy, making it unsustainable. The number of uninsured Americans continued to grow, leaving millions without access to affordable care and necessary medical services. The system was fragmented and complex, creating administrative burdens and inefficiencies. Something had to change urgently. The debate over healthcare reform intensified, with calls for fundamental changes to address the growing crisis and improve the system. The stage was set for a historic attempt at reform, the Affordable Care Act, aiming to transform healthcare.